All right, we're going to begin this hour. We're going to make a tough turn here because we got a sharp story about homelessness in this country. This is a massive issue all over the place, and it's often coupled with public fear related to crime, and with good reason. Since 2015, there's been a massive 35% increase in the number of people who are sleeping or camping outside. This is a so-called unsheltered population of homeless, and these are people who turn to tents, they turn to tarps, to boxes, to cars, public transportation. And to understand why some people choose the streets even when a public shelter is available, we talked to a man who was sleeping on a bench as recently as 2019 and another who is now in his car. And while everyone agrees that more housing is what is needed in the long term, the question for many of these mostly Democratic mayors and governors is, what do we do with the people on the streets right now? It's getting harder and harder to ignore.
All you have to do is walk to work, drive to work, and you see homeless people all scattered all over the place.
A source of heartache or frustration for just about everyone.
It's difficult to walk on that side of the street where there's a homeless encampment.
The question is, how do we help the more than 230,000 people living on the streets in this country? And while lots of local leaders have promised a fix, none have gone quite as far as New York City Mayor Eric Adams.
You can't put a Band-Aid on a cancerous sore.
He's not only launched an effort to clear tents and other structures, he's also stepped up interventions on the subway, pushing people towards what he says are supportive and voluntary services.
There is no dignity to living on the street.
But then came a policy of involuntary removals, allowing a police officer to take into custody a person who appears to be mentally ill and displays an inability to meet basic living needs, even when no recent dangerous act has been observed.
If severe mental illness is causing someone to be unsheltered and a danger to themselves, we have a moral obligation to help them get the treatment and care they need.
How do you feel about what the mayor has done?
Sigh.
Donna Leiberman is director of the New York branch of the American Civil Liberties Union.
What the mayor is doing is throwing more police at a problem that requires a public health solution.
Adams announced his plan, which includes transport to a hospital for psychiatric evaluation, after a series of high-profile crimes.
Police say a woman was shoved onto the tracks,
including killings in New York and Los Angeles.
And that homeless man ran in and apparently started attacking them at random with a knife,
where the suspects themselves were homeless men with a history of mental illness. It's such a high-stakes and delicate call, the line between somebody who is free and just having a bad day and someone who is an imminent danger to themselves and others. Sometimes the first evidence is the actual act of violence.
Well, who's in the best position to make the judgment call? Is it police? Or is it the public health system? Is it medical folks? And I think it's medical folks.
While Mayor Adams declined our request for an interview, in a statement he pointed out the city is expanding capacity at medical facilities, while also boosting crisis services and behavioral health emergency teams.
Hey, I'm Tony.
How's everything?
On one of the last cold days of winter, we met Shams DaBaron in Harlem, not far from where he used to sleep.
Which spot was you?
I would be right here.
In years past, he might have been somebody flagged for removal and evaluation by Mayor Adams.
Move on this now!
Instead, he's become one of the mayor's biggest allies.
I'm not comfortable with seeing my people out here like this. I want to do something about it.
Yeah.
You know, it's easy when you never lived this experience to think it's okay, to be able to say that that box is that person's home. I don't think it's okay. And so my goal, and I know the mayor's goal, is to say, you know, we're going to do something about this. We're going to get these people help. We're going to try to stabilize their lives. And ultimately, we want to get them housing.
I'm Tony.
He wanted us to meet Cornelius Parker, better known around here as Magnificent.
You used to live right here?
Right here, right there, was born down the block.
Not long ago, Parker lost his job and then his home.
So where are you sleeping now?
I sleep right here in my car.
You sleep in your car.
Sleeping.
And what's your plan for getting back on your feet?
Well, I'm trying to find housing.
For now, like so many people here in New York and elsewhere, he chooses the streets, even when shelters are available.
The shelters are not safe. I used to work in the shelter. I've been in the shelter. You see stabbings, and it's not safe.
If you lost your vehicle and you had to
Right.
sleep on the street, you would choose the street
I would choose the street. I'd be a lot safer
than the shelter.
than the shelter.
That's how DaBaron once felt as well.
I didn't trust anybody. So I wasn't looking for services. I was comfortable where I was at. But I went from what have been mild depression to severe depression. Wow. And fortunately, I thought about my children and I said, I gotta get some help.
He got it walking himself into a mental health facility. And now he wants others to benefit from that very same sort of care, even if it means the hand of government has to get them there. Either way, there is at least agreement on help. More is needed.
Not having nearly enough housing for people who need housing with support services, that's the real shame. That's the real crime. That's what's undermining the dignity of too many New Yorkers who are vulnerable and forced to live on the streets.
We need serious federal intervention in this. Otherwise, we're gonna see a lot more lives lost to homelessness. We're gonna see a lot more people dealing with trauma and mental illness and substance abuse. And it's just gonna create a bad situation for all of us.
I think we can all agree it's a bad situation. DaBaron came off the streets in 2019 after he accepted treatment for his depression, also his drinking, and he credits that intervention, which he volunteered for, was saving his life. But, you know, we mentioned a personal connection I have to this story. It's my own father. For much of 1989 and 1990, off and on, in the depths of his own addiction, his own mental health issues, he was sleeping under the I-95 overpass in Miami by the Miami River there. I visited the location with him. What's interesting on this question of forced care, with people on the streets right now, I talked to my dad about it last night, he would have resisted somebody coming up to him and saying, you got to move out of here and get into treatment or some sort of other service.
Even though the people that love you want you to do this.
He would have resisted it. But
wow.
as a family member, I would have been all in favor of it.
Yes, of course. Yes.
And so, I mean,
there lies the dilemma, right?
There's a dilemma. Like in the wider human family here, we see these people suffering. We want them to have help. They don't want it. At what point is it mandatory?
Yeah.
They don't want it, or maybe they don't think it's necessary. And now you're talking about a forceful removal of somebody that is unsheltered.
Yeah.
Did your father have an answer if he says, listen, I would have resisted? I don't know what you do if you try to help somebody and they don't want to be helped.
There is no answer.
Yeah.
I don't know what the answer is. He said he would have resisted and violently. He did not want to go.
Until you talk to the man named Magnificent, maybe this is naive on my part. It never occurred to me that they would think the street is safer than a shelter.
Yeah.
That never occurred to me.
That's very common in New York. And I don't know a lot about the shelter system, but I heard that repeatedly from multiple people that it's a tough situation in there.
Tony, that was a really good piece.
Yes.
Thanks, guys.
More to come.